Dr. Sauter, welcome to Health Connection. Nice to see you again. It's always a pleasure. We're talking about the success that we've had with respect to treating cancer and declining cancer death rates. Good news. A new report came out in January of 2014 from the American Cancer Society that says the rate of cancer deaths among Americans is continuing to decline. Tell us a little bit more about the findings in that report.
There's been a 20% decrease in mortality rates in the last 20 years, and that's dramatically exciting news. It means that we are making progress in the treatment of cancer, and I think that there's more to come.
Which cancers have declined the most in the past, say, 20 years?
Stomach cancer, breast cancer, lung cancer, especially in men, although it's also going down now in women, and colorectal cancer.
That's good news. And bad news, are there cancers, the rates of which are increasing?
Yes. Liver cancer and pancreatic cancer, both of which are very deadly, are on the rise.
You mentioned this in the answer to the first question. Is this an overall decline? Is it spread evenly across ages, genders, and races, or is it specific to?
No, as I mentioned, African American men especially have seen the greatest decrease in mortality in the last 20 years. And they have still the highest mortality among all racial and ethnic groups. So it's really good that it's more dramatically decreasing.
So that in that sense, they had the most ground to make up, but they're making up the ground.
Most quickly.
Very good. What's contributing to this? What factors are in play?
It's probably, we're not sure, but it's thought to be both a combination of earlier detection and better treatment.
We smoke less. Any changes in the environment making a difference?
Well, screening, colorectal cancer screening, is on the rise in all racial and ethnic groups. Lung cancer screening has just been approved by the U.S. Preventive Services Task Force, so earlier detection of lung cancer.
Tell me about that screening. How is it different from what we've been doing before?
Well, in the past, studies have not shown that lung cancer screening was beneficial. And that was primarily because we were using older technology. But with low-dose CAT scans, we are detecting nodules earlier, and it has led to an improvement in survival.
Based on the American Cancer Society's 2014 report, who's still at greatest risk overall of dying from cancer?
African American men are still at the greatest risk of dying from cancer. White women have a higher incidence of cancer, but black women have a higher death rate.
What about the total number of diagnoses of cancer? Is that number declining as well? Are we seeing it less as a percentage of the population?
Well, as I told you, the number of cancers diagnosed has not changed that much overall. But different cancers, some have gone down a lot in incidence as well as in mortality, and others have gone up in incidence and subsequent mortality. So it depends on what cancer you want to talk about. What I really think the message is that the death rate, the mortality rate has gone down by 20%. And that's the really best news we have.
What about regional factors, regional cancer rates? For example, we know that the rates of prostate cancer, lung cancer, colorectal cancer, higher here in East Texas than elsewhere in the state of Texas.
That's right.
Tell us about that.
Well, again, we don't know for sure. These are presumptions, but again, I think it's an issue of early detection and treatment, or lack thereof. We live in a very rural area. Lack of insurance is a bigger problem in Texas than in the nation, and especially in our area. That sometimes leads to difficulties. Additionally, travel is sometimes far to get treatment, and screening rates tend to be lower. For all of those reasons, it's my opinion at least, that we have these higher mortality rates for those cancers.
So these are socioeconomic more than environmental, would you say?
Well, that's the mortality rates, the higher mortality rates are due to that. The higher incidence rates are bad lifestyle.
Okay.
As well as perhaps other things. But I mean, smoking is the leading cause of preventable death due to all sorts of cancers, lung cancer being prime and among all those. And the smoking rates in East Texas are among the highest in the nation. The diet one's diet, most of us believe, is important to colorectal cancer rates. That is, low fiber, higher risk; high fiber, lower risk; and other factors in our diet that lead to the stimulation or the prevention of cancer. And so it's likely that our lifestyle in East Texas leads to a higher incidence of these three cancers you mentioned.
So, as good as the news is, we have more work to do to fight this disease, correct?
Absolutely. And we're working very hard here at the Health Center, as well as in other areas of East Texas, to provide better access, more screening, more letting people know about what's available, and give treatment in as timely a fashion as possible.
Very well, Doctor. Good to see you, and thank you.
Thank you.